Good afternoon. Myself Dr. Mahesh Sudhakar Murme, second year resident of Dr. Vilas Patel Medical College and Hospital, Jalgaon. I would like to present poster on the topic named as From Pixels to Scope, Radiology and Arthroscopy in ACL Ligament Injury Evaluation. So, the introduction to my topic is the knee joint is most commonly involved due to road traffic accidents and sports activities. The stability and normal mechanics of the knee joint is affected by the injury to the ligaments and meniscus, which leads to the instability of the joint, impairing the person's daily activities. Therefore, early diagnosis and appropriate treatment should be given to decrease the morbidity. The knee joint is the largest synovial joint in the body containing various ligaments. The most important of them are anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, which are responsible for the stability of the joint. Various imaging modalities are used to evaluate the knee, including radiography, CT scans for the fractures, and MRI for the soft tissue injuries in the knee joint. Also, arthroscopy of the joint can be used for both diagnostic and therapeutic purposes. So, MRI, being a non-invasive modality, is increasingly being used in evaluation of cases of internal derangement of knee and is also being used in pre and post-op evaluation of meniscal and ligamentous pathologies. It has high spatial and contrast resolution and can detect most of the pathologies of the knee with high accuracy. So, arthroscopy is regarded as the gold standard among the investigative modalities. So the materials and methods used for the paper study are a cross-sectional study was conducted in our hospital. The study was done for a period of duration from May 2024 to January 2025 on 20 patients with suspicion of traumatic ligament injuries of the knee joint. The MRI technique used was an informed consent was obtained prior to the study after explaining the procedure of the examination to the patient. The examination were carried out in a Siemens 1.5 Tesla MRI machine. The patient was placed in supine position on the MRI table. The knee was kept in the coil in extension and 10 to 15 degree in external rotation because it gives better imaging of the anterior cruciate ligament, and the knee was secured in the coil by centering the joint. The MRI scan was done using sagittal T2 fat set images, proton density fat set images, stir images, coronal proton density fat set images, axial stir sequences using the standard imaging protocol. The interpretation of images was done, and it were acquired digitally with the use of a picture accurate communication system in DICOM format. The ACL was evaluated on sagittal, coronal, and axial images and categorized as intact or torn. It was a normal ACL when it showed an hypointense band-like structure and the presence of focal discontinuity or complete absence of ligament, abnormal signal intensity of the ligament, wavy contour, or poor definition of its ligamentous fibers were all considered as eight ligament. So the case one is a 19-year-old male came to our hospital with pain and swelling over right knee since 15 days, after which the MRI of the knee joint was done, which showed partial tear in the anterior cruciate ligament, and it appears bulky, which shows abnormal hyperintense signal. The case 2 was 16 years old male came to our hospital with pain and difficulty while walking since 1 month in the left knee. It showed anterior cruciate ligament with complete tear, and it was also appearing buckled with likely avulsion at the femoral attachment. Then the case 3, a 41 years old male came to a hospital with difficulty and pain while sitting and walking since 2 months in the right knee. After the MRI done, it showed partial to near complete tears in the anterior cruciate ligament, in which the whole of anterior cruciate ligament looks bulky with hyperintense signal. This is the last case, that is a 20-year-old male came with pain and swelling over left knee since 1.5 months. When the MRI was done, it showed anterior cruciate ligament was completely torn and not well visualized. Few remnant fibers of the anterior cruciate ligament appears torn, bulky, buckled, and shows abnormal high intense signals. So after this, the arthroscopic examination was done. The arthroscopic examination was done by the orthopedic surgeon of our hospital. All the arthroscopies were performed under spinal anesthesia. They routinely divide the knee into following compartments, that is suprapatellar pouch, patellofemoral joint, medial gutter, medial compartment, intercondylar notch, posteromedial compartment, lateral compartment, lateral gutter, and posterolateral compartment. A thorough examination of the knee was performed and the pathologic structure was identified. Further surgical intervention was carried out accordingly and ACL reconstruction for the ACL tears was done. In isolated cases of ACL tears, ACL reconstruction was done using semitendinous gracilis graft or patellar tendon bone graft. The first image shows the normal ACL seen after the arthroscopy, and second image shows the torn intercruciate ligament in the arthroscopic examination. Now these are the images of the arthroscopy. The first image shows the anterior cruciate ligament tear, which is shown by the hollow arrow, and second is the normal posterior cruciate ligament, which is shown by the solid arrow in the first image, and the second image shows the reconstructed anterior cruciate ligament, which is shown by the hollow arrow. What are the results? The study included 20 patients with age ranging from 18 to 45 years with a mean age of 27.7 years at the time of admission. 14 of them were males and 6 of them were females. On MRI, all 20 patients showed ACL tear. Comparison between MRI and arthroscopic findings for ACL tear showed 19 patients being true positive and 1 patient being false positive. In our study for detecting anterior cruciate ligament injury in our study, the sensitivity was 95%, positive predictive value was 100%, and accuracy of MRI was 95%. The Fisher's exact test was employed to calculate the statistical significance and p-value. Here the p-value for ACL tear is 1, which is statistically not significant. This is the bar diagram showing age-wise distribution of ACL tear in all patients. Mostly the highest incidence is seen between 20 to 30 years of age, as this age of population is highly involved in the strenuous activities, sports, and other highly workaholic activities. These are the tables showing the positive and negative incidence and values between MRI and orthoscopic findings for the ACL tears, and the second table shows sensitivity, which is 100%, positive predictive value, which is 95%, and the accuracy of MRI is 95%. What is the conclusion of our study? The MRI is a non-invasive, radiation-free, and an excellent imaging modality to evaluate ligaments of the knee joint and surrounding soft tissue. The diagnostic yield is increased with appropriate use of the sequences and proper analysis of all images in all places. Almost all the ligamentous and meniscal injuries can be diagnosed with a high level of confidence. Pathological entities should be carefully differentiated from normal variants, pitfalls, and artifacts of imaging. In traumatic setting, in post-traumatic knee, MRI evaluation before arthroscopy has been proved as cost-effective. Despite the fact that arthroscopy has altered the management of knee pathologies, most orthopedicians admit the limitations of the procedure in the evaluation of extra-articular pathology.